scary. What brings you into that?
Well, my son here, he's been having a lot of involuntary eye blinking for as long as I can remember. And recently I just received a call from a teacher saying that he, right in the middle of the test, just started involuntarily screaming out words.
That didn't happen, Mom. Teacher's a liar. She doesn't know what she's talking about.
Put the phone away.
No.
Just listen.
I see what you mean.
Yeah. It's okay. I put many hours into research about this, and a lot said that it's an inherited trait or even a abnormality in a neurotransmitter. So.
Yeah, the research is still being done on that, but it's thought to be a neuropsychiatric disorder. It's seen on axis 1 of the DSM-4, and the diagnostic criteria include having motor and verbal tics. Some of the examples, it's okay, Fred. Some of the examples of simple motor tics are eye blinking, which your son has exhibited, some neck jerking, shoulder shrugging, facial grimacing, any kind of coughing. More complex motor tics become touching or squatting, hopping, skipping, deep knee bending, retracing steps, twirling when walking. Vocal tics could include clicks, grunts, yelps, barks, sniffs, snorts. It's okay, you don't have to bark. Coughs, uttering or uttering of obscenities. They could also have palavia, which is what your son seems to be doing, which is when he repeats himself.
Yeah.
They could also have echolalia, which is repeating of others.
Okay. Yeah, he repeats himself, not really a lot of
I
times.
do not.
Yeah, well, I think it's safe to say your son has Tourette's.
Yeah, you think so?
I think so. I think I'm going to refer you to family therapy and see what goes on from there. All right?
Sounds good.
All right, well, it was nice to meet you both, okay?
Thank you so much.
Okay, we have a 2-year-old coming in with Tourette's syndrome. His mother said that he had eye blinking and he just wasn't feeling right. He was acting out in school. So he's being brought into us so that we can further evaluate him and see what's going on and hopefully teach him some techniques and ways to help manage his Tourette syndrome. I'm just going to give you guys a brief, a brief overview of what Tourette's is and how to deal with these patients. Basically, with these type of children, they're associated with depression, OCD, ADHD, anxiety, and oftentimes by focusing the attention on them, continue to it makes them tick even more. So if you notice that he's ticking, what you want to do is just kind of ignore it and continue to have your conversation, and he'll eventually get his tics out. Another thing that you don't want to do is you don't want to tell him to stop his tics. So by suppressing the tics will cause him to increase his anxiety and tick even more. When you think of ticking, think of like having to scratch an itch. When we itch, we have to scratch the itch. These patients cannot stop ticking. As much as you say, don't do it, stop, control it, they can't. So we just have to be mindful, and as we also need to be non-judgmental, and we have to offer support to the parent, to the mother, and just
Ready? Come on. Let's go inside, Fred. All right, Fred, Allie, this is Dr. Jones and Nurse Katie. They're going to help you, okay?
Put your phone away.
Nice to meet you, Fred. All right. I'll see you guys later, okay? I'm going to go back to see my patients.
Okay. Well, hi. Thanks for coming. I'm Dr. Jones, and I'll be here to talk to you a little bit more about your Tourette's, and I'll give you some ways to help cope with. The biggest thing with Tourette's is education. So that's why I want to educate you, and you can further educate the school and the staff and the people that will be working with him, because this is a very unique disorder. Encouragement should be given to him because
encouragement, really?
this is normal, and this is normal for him, and
Yeah.
you need to express to him that it's okay to tick. So, what do you like to do for fun?
Lots of stuff.
Lots of stuff.
Like sports and music.
You like music, huh?
Yeah.
A lot of music. He loves music.
Yeah.
What does music do for you?
Relaxes me. Makes me happy.
Good.
Okay. So I'm just gonna give you some pamphlets on Tourette's and also OCD as well as ADHD and depression, because we don't want those things to develop. We don't want him to be depressed, and as far as isolation. Also, if you ever notice him ticking, it's okay, and you need to express to him it's okay to do so, and he
I don't
shouldn't
tick.
suppress
I don't
his
tick.
feelings
Okay.
of ticking. Okay, so here's the
Great, thank
pamphlet.
you.
Okay.
Oh, look what we
No,
got.
I don't tick, Mom. I don't want to.
Okay, I think everyone should
I
step
don't-
out.
You need to.
You guys.
Fred's gonna take. Fred, we have a
Uh-oh.
piano over here. Fred, we have a piano over here. Do you want to play some music?
I don't know how. I don't
Yes,
know.
you do. Here, I'll show you. Sit down. Okay. You can just play the keys. Take a deep breath. How do you feel?
Good.
Okay. Are you not stressed?
Yes.
Okay. Let's go back in the room. Mom, everyone can come back in. Go back down. Feeling better?
Yes. Yes.
Good. He's getting worried.
Alright, so what we just did was called tick time, where he can take himself out of the situation when he's really stressed and feels like he needs to release those ticks. And for him, music is a really good therapy, a really good outlet, so now he's less stressed. And you can know when he might need tick time at home, or let his teachers know that at school that he might need to take himself out of the room for a little and have some time alone. That way, there's not too much attention brought on him and he can release his stress.
So music, definitely, right?
I like music.
Good. All right. So we found one way that he can calm himself down. That's really
Hi
good.
guys, it's nice to meet you.
Hi.
I am the nurse practitioner here. My name is Gretchen. So I just spoke to your nurse and your therapist, and we decided that we are not going to prescribe you medication today.
Wait, why not? He just went in tiff, like he just went out.
Well,
crazy.
we just
Tell
want
me
to
that.
we just
Tell me
want him
that.
to try him to try the interventions that you learned today here before we start him with the medications, because there can be some heavy duty medications with this with some really bad side effects, unwanted side
Okay.
effects. So we'd like you, Fred, to try those interventions, the deep breathing and going to music to calm you down before we start the medication. I'd like you to good. I'd like you to keep a journal by writing down your thoughts and feelings, what precipitates your tics, what makes them worse, what makes them better, so we can find those common themes and maybe modify them for you. How does that sound?
I'll buy you a nice good journal. You'll like it.
Okay.
Okay, so we'll see you back here in 2 weeks.
It is difficult to classify someone with Tourette's disorder in a certain stage of a theoretical model due to the nature of the disorder. It is easy for them to regress to an earlier level of development because of their constant struggle they face while confronting their current problems. Hildegard Peplau, her interpersonal theory, states that during the developing skills and participation stage, one must learn the skill to compromise, compete, and cooperate in order to help establish a more realistic view of the world and feeling of one's place in it. This helps patients, especially with Tourette's disorder, to identify the problem, define a goal, and take responsibility in order to reach their goal.
So a treatment plan can involve one or more of the following. The treatments could be non-pharmacological, such as relaxation therapy or behavioral therapy, be medication treatments with muscle relaxants or neuroleptics, or surgery as a last case resort. Typically, a combination of these therapies is best. If we start off with behavioral therapy, like non-pharmacological, it's designed to change the pattern of your child's behavior, such as habit reversal. And because people with Tourette's are typically unaware of their tics, it comes in 2 stages. The first stage is to monitor the frequency of the tics and the sensations that lead up to triggering them. And the next stage is to find an alternative, less noticeable method to deal with the tic. For example, if your child has a coarseness in their throat or an unpleasantness in their throat right before they have a grunt, you can teach the child when they have that feeling to do some deep breathing exercises to prevent the tic from happening. This would be like habit reversal is often combined with relaxation therapy such as deep breathing or visualization. For medication, there's 3 classes. There's alpha-2 adrenergic agonists. They're used to treat mild to moderate symptoms of Tourette's, and they work by the basal ganglia misfire, which is what triggers tics, and they work with norepinephrine to try and stop that. However, they can have lots of side effects that can be pretty serious. The next class of medication is muscle relaxants. They help control tics, particularly physical tics, things such as baclofen and clonazepam. The only thing with them is you need to avoid machinery and avoid driving with them, also avoid alcohol. The third class would be neuroleptics, and those are the most effective medication in preventing tics, but they also have a lot of side effects, and they should only really be used if your child doesn't respond well to other medications or other forms of treatment, because they work by blocking the effects of dopamine on the brain, which we know dopamine is quite important. There's 2 main classes of neuroleptics. There's typical and atypical, and atypical are usually recommended because they have less side effects. Some of the side effects can be drowsiness, shaking, trembling, muscle twitches, spasms, loss of libido, weight gain, blurred vision, and they could be potentiated even more with typical neuroleptics. The third option of treatment is surgery, and surgery is used as a last resort for those who fail to respond to other types of treatment, and there's 2 main surgical procedures. One being a limbic leucotomy, which is where a neurosurgeon uses electric current and radiation to actually burn away a part of the limbic system. And we know the limbic system is important for things like emotion and memory and behavior, so it can be very, very dangerous. And they're essentially rewiring your brain, so you got to be very careful with that. The other method of surgery is called deep brain stimulation. That's where electrodes are permanently attached into your head, and they're hooked up to generators, and their pulses are sent, and the brain is stimulated. And this is very early in this treatment, and it's not really very refined, but the early results seem to show a lot of success using this type of treatment.
Treatment for Tourette's are behavior therapy. By using modification techniques, self-monitoring, and self-control, along with reinforcement procedures, the patient can have feedback if he or she is progressing well. So this is good in group situations. They can hear feedback from their peers about their behaviors, and they can also monitor their own progress, and they can change their behaviors accordingly from the feedback. You can also allow physical outlets for the patients with Tourette's. It allows their frustration to be released. The excess physical energy can be released through physical activities, and it can induce relaxation after. One-to-one with the client, you build a trusting relationship with your client with Tourette's. You can provide information and management techniques and treatment options for them. You can explore feelings that they may have about their illness and ways to help them incorporate themselves into their own treatment and for them to feel a healthy sense of self. The nurse using herself to help treat her patients with Tourette's. You can encourage remission of tics, and you can discuss disruptive behavior, and you can also, those would be great times to implement behavior management techniques. And it's important for the client to also use themselves. They must know what techniques they're using and why they're using them. The patients who understand their techniques are more often to be engaged in their treatment, and they have better outcomes.
For alpha-2 adrenergic blockers, agonists. Okay, so we're ready.
Okay. We'll cause him to
Increases.
yeah, increases it. Thank you. Increases it, so you're gonna crop that out.
Being a limbic leukotomy. One being a
Disorder, stress and unique. Yeah, that's fine.